Brain malformations refer to structural abnormalities in the brain that occur during fetal development or early childhood. These malformations can affect the overall shape, size, and organization of the brain, leading to various neurological symptoms and potential health complications. Here are some common brain malformations, their symptoms, and precautions. Neural tube defects, NTDs. Symptoms: NTDs are characterized by incomplete closure of the neural tube during early development. Examples include spina bifida and anencephaly. Symptoms vary depending on the severity and location of the defect and can include paralysis, intellectual disabilities, hydrocephalus, excess fluid in the brain, and motor or sensory problems. Precautions: taking folic acid supplements before and during pregnancy is crucial in reducing the risk of NTDs. It is recommended that women of childbearing age consume 400 to 800 micrograms of folic acid daily. Chiari malformation. Symptoms: this condition involves the displacement of the cerebellar tonsils into the spinal canal. Symptoms can include headaches, neck pain, dizziness, difficulty swallowing, muscle weakness, and sensory problems. Precautions: there are no known preventive measures for Chiari malformation. However, early diagnosis and appropriate medical management can help alleviate symptoms and prevent further complications. Dandy-Walker syndrome. Symptoms: Dandy-Walker syndrome is characterized by the partial or complete absence of the cerebellar vermis, cyst formation, and enlargement of the fourth ventricle. Symptoms can include developmental delays, intellectual disabilities, problems with coordination and balance, hydrocephalus, and seizures. Precautions: Dandy-Walker syndrome typically occurs sporadically and is not preventable. Management involves treating associated symptoms and complications. Agenesis of the corpus callosum, ACC. Symptoms: ACC refers to the absence or underdevelopment of the corpus callosum, which connects the two cerebral hemispheres. Symptoms vary widely and can include developmental delays, intellectual disabilities, seizures, motor problems, social and emotional difficulties, and sensory impairments. Precautions: ACC is often present from birth and is not preventable. Early intervention and specialized educational support can help manage the associated challenges. Holoprosencephaly. Symptoms: holoprosencephaly involves incomplete separation of the brain's hemispheres during development. Symptoms can range from mild to severe and may include facial abnormalities, intellectual disabilities, motor delays, seizures, hormonal imbalances, and feeding difficulties. Precautions: holoprosencephaly can have various genetic and environmental causes, and preventive measures are not well established. Prenatal genetic counseling and screening may help identify potential risks. It's important to note that each brain malformation has its own specific characteristics, symptoms, and management strategies. If you suspect your child may have a brain malformation or if you have concerns, it is advisable to consult with a healthcare professional or a pediatric neurologist who can provide a proper diagnosis, guidance, and appropriate medical care for your child.